The subjective examination is the first step of the clinical assessment. By tapping on the body chart, you can draw the patient's symptoms using a color of your choice. You can also choose a pencil width from the available options. With the red cross, you can mark the areas with neurological symptoms. With the green check, you can mark the areas that are clear of symptoms. By tapping on the camera symbol, you can take a snapshot and drag it to any part of the screen you want. To finalize, tap on the empty space. By tapping on the white folder symbol, you can add a custom note by using the keyboard or the drawing tool. You can also drag this to any point. Tap on the return symbol and go back to the main menu. Select Main Problem to see a list of basic questions for the symptom description. You can add an asterisk to answers to mark them as important. Accordingly, you fill out questions that are relevant to symptom description, special care, autonomic nervous system. Tap on the return symbol and then tap on the body chart to place the information regarding symptom 1 at any spot that suits you by dragging and dropping the text box. Upon returning to the main page, you can tap on +sign to create a new symptom. You can follow the same routine to draw the symptom on the body chart. By tapping on the new symptom, a list of new questions will appear, which you can fill out in the same manner as before. Next in the subjective examination are the extra questions. You can add here the symptoms relations. Wherever the light bulb icon is available, there is relevant information for that specific topic or part of the examination. You can also fill out the safety questions and the activity restrictions. You can slide to the right in order to grade from 0 to 5. Depending on your answers, the relevant flags will light up. On the top part of the screen, over the body map, there is an Edit option. By tapping on that, you can choose among several body charts or remove one that you don't need. Continuing with the subjective examination, there are a few more categories you can ask questions from. 24-hour behavior. Bear in mind that it is up to you to decide which fields you want to fill out. You can tap on the asterisk sign to mark information as important. On any page, you can add a custom note by tapping on the pencil symbol, which is on the top left part of the screen. By tapping on the plus sign at the field you want to add your notes, a window will pop out for this purpose. You can mark important custom notes as asterisks as well by tapping on the asterisk sign. You can fill out the 24-hour behavior for each symptom. The next category are the screening questions. They are specific to the body region in question. You can tap on the plus sign on the body region you choose and select among the preset choices, or tap on Other to add a custom note. Following is the symptom history. In the current history, you can choose among traumatic incident, idiopathic onset, and answer the corresponding questions. You can also fill out data regarding medical care and medication. When an answer poses a possible risk factor, then a red flag will automatically light up. You can also fill out the past medical history following the same routine. You can take a snapshot of the investigation images your patient might have and add a title to it by tapping on the pencil. You can also draw on the photograph by tapping on it and selecting the drawing tool. The next category is general health. You can do a quick examination or ask questions per system. With the quick examination, you can choose among common symptoms, diseases, and habits. You can tap on the plus sign on the category you want to select from the list. With the questions per system, you can tap on the plus sign to view the questions for this given system. In this way, you can reduce the chances of omitting to ask something important. The final category of this objective examination is the patient's opinion and has to do with the patient's thoughts regarding his or her problem. At this stage, you can also record the contributing factors and the patient's goals. You have now completed filling out the subjective examination. Tap on the return sign to go back to the main menu of the patient's file.